We will be discussing Chapter 7 in your statistics textbook, autopsy rates. An autopsy is the exam of a dead body to try and determine the cause of death. Autopsies are performed in order to educate physicians and some other allied health professionals as well. An autopsy can be performed on the entire body or just on a particular organ. Other names for autopsy is necropsy and postmortem or after-death examination. Autopsies are generally performed by a hospital pathologist or a physician who's on the medical staff who has been delegated that particular responsibility. They're usually done in a hospital morgue, but in the case of small hospitals that do not have a designated morgue, the body may be removed to an off-site lab or a funeral home, and the autopsy may be performed in that location. The autopsy rate is the proportion of deaths that are followed by the performance of an autopsy. The gross autopsy rate, that's the ratio during any given period of time of all inpatient autopsies compared to all inpatient deaths. The rate is usually reported as a percentage. Again, the concept of a rate applies the number of times something actually happened compared to the number of times it could have happened. So statistically speaking, every patient who died could be autopsied. Typically, newborn autopsies are included in the gross autopsy rate, but they may be calculated separately if the hospital or medical staff decides so. And the formula for gross autopsy rate is total autopsies on inpatient deaths for a period of time times 100 divided by the total inpatient deaths for that same period of time. The net autopsy rate, that's the ratio during any given period of time of all inpatient autopsies to all inpatient deaths minus any unautopsied coroners or medical examiners cases. The formula for net autopsy rate differs just a little from the gross autopsy rate in that it excludes bodies that have been removed by the coroner or by the medical examiner. Certain types of deaths are reportable to the coroner. A coroner is the official who is responsible for determining the cause, time, and manner of death. Coroners may have other duties depending upon the state. Some areas may call a coroner a medical examiner, but they are essentially the same thing, that person who is appointed to perform autopsies. A body that's released to a coroner or a medical examiner is not available for autopsy by a hospital pathologist. So you can see the formula for the net rate is the same as for the gross, except in the net we are subtracting the unautopsied coroners or medical examiner cases. A hospital inpatient autopsy is the postmortem exam that is ordinarily performed in a hospital on the body of an inpatient who died during their hospital stay. In contrast, a hospital autopsy is the postmortem exam of a body on the body of a person who has at some time been a hospital patient. Former inpatients may include ER patients, outpatients, and home care patients. When we're determining what autopsies to include in a hospital autopsy rate, these are some of the guidelines that we need to think about. Hospital autopsies are usually performed by the facility pathologist. However, small hospitals, as we talked about, do not always have a pathologist on staff, so that responsibility for doing autopsies may be delegated to another physician. Normally, hospital autopsies are performed in hospitals. Again, those small hospitals may not have the facilities that they need to perform autopsies. In that case, they can be performed at another location, such as a funeral home. As a general rule, hospital autopsies are performed on inpatients who have died. However, because of the educational value of autopsies, former inpatients who were not in the hospital at the time of their death may be considered for hospital autopsy. Again, those may include ER patients, outpatients, home care, or hospice deaths. This is the only case where outpatients are included with inpatient statistics. Fetal autopsies are not included in a hospital autopsy rate because a fetus is not considered a patient. The essential components for a hospital autopsy include the autopsy must be performed by a staff pathologist or other delegated physician. There must be consent from the patient's next of kin or legal representative to perform an autopsy, which has to be filed in the patient's medical record. The autopsy report must be filed also in the patient's medical record. The tissue samples must be filed in the hospital lab along with the autopsy report. The adjusted hospital autopsy rate, that's the proportion of hospital autopsies performed following the death of patients whose bodies are available for autopsy. Although many hospitals calculate the net autopsy rate for different surveys and external reports, the adjusted autopsy rate is really more accurate indication of the hospital's resources for physician education because it does include all autopsies. The formula for adjusted hospital autopsy rate is total hospital autopsies times 100 divided by total number of deaths of hospital patients whose bodies are available for hospital autopsy. Patients whose bodies are available for hospital autopsy include inpatients, unless the bodies have been removed from the hospital by legal authorities such as the coroner or the medical examiner. Other patients, and, however, if the hospital pathologist or that delegated physician performs an autopsy while acting as an agent of the coroner or medical examiner, that autopsy is included in the numerator and the death in the denominator of the adjusted hospital autopsy rate formula. Other patients, including hospital home care, outpatients, and previous hospital patients who died elsewhere and whose bodies have been made available for the performance of an autopsy, these are considered available for hospital autopsy. The newborn autopsy rate is the proportion of hospital autopsies that are performed following the death of newborns. The formula is newborn autopsies for a period times 100 divided by the total newborn deaths for that same period of time. The fetal autopsy rate is the proportion of hospital autopsies that are performed following the deaths of intermediate and late fetal deaths. The formula for fetal autopsy rate is autopsies that are performed on intermediate and late fetal deaths for a period times 100 and divide that by the total of the intermediate and late fetal deaths for that same period of